All right, we'll get started in just a couple seconds. We just want to do one more sound check and make sure everything sounds all right. Check 1, 2, 3, 4, 5. And over here for questions, 1, 2, 3, 4.
Good afternoon. I'm Dr. Martha Buchanan, Senior Director and Health Officer here at the Knox County Health Department, and I apologize for being a minute or so late. I want to begin today by briefly discussing yesterday's news release regarding the loss of the Pfizer vaccine. While we won't be making any comments about the situation in order to ensure the integrity of the investigations, we do want our community to know that we remain committed to transparency and are eager to cooperate with all third-party reviewers. That's why I asked KPD to conduct an investigation so we can learn more about exactly what occurred. While nothing so far has indicated criminal activity, we want that to be confirmed. While we wait for the findings from both investigations, we will continue to implement process improvements internally to ensure this doesn't ever happen again. We remain committed to our service to the community and ensuring our operations continue in a way that reflects our high level of integrity. Our moment of gratitude is dedicated once again to the Knox County IT Department and our KCH team members for ensuring last week's waitlist rollout went smoothly, and I think it did go smoothly. As of this morning, there are 9,000 people signed up on the waitlist. We've already been able to utilize this waitlist to reach out to folks and schedule several hundred first dose appointments through KCHD and our community partners for this week. If you are signed up on the waitlist, you may get a call from an unknown number to schedule your appointment. Please do not ignore this call. As a reminder, KCHD will never ask for your social security number or banking information. So if you get a call asking for that information, it is not us and could be a scam. So additionally, if you've already received your vaccine, so you signed up between then and now you've received your vaccine, or between then, whenever you receive your vaccine, please call either the public health or public information line, 865-215-5555, or 311 and let us know so we can take your name off the list and allow somebody else to move up on the list. As a reminder, this is a living list. So if you qualify based on the current phase requirements, you can visit our website at covid.knoxcountytn.gov and sign up. If you don't have access to a computer, you can call our public information line at 865-215-5555, or you can call 311 and one of the operators will help you sign up. We want to extend a thank you to our public information line team and members from folks from 311 for providing this critically important service to the community, as we do not want computer or internet access to be a barrier to receiving vaccines. Currently, we are vaccinating those who fall in the first two priority groups, such as healthcare workers and first responders, and those who are 70 and older. A full list of eligible groups can be found on our vaccination information webpage. Check back regularly because that will change over time. We've received several questions about when we will progress to the next phase. It's our intent to move to the next phase when supplies allow, when we feel like we've vaccinated the majority of the individuals in our current phase. However, if the state moves our surrounding counties into the next phase, we plan to stay in alignment with them to limit confusion for our community. This is what happened when we moved to the 70 and older phase age group. So we will continue to follow the state in order to maintain consistency and clarity for our citizens. This week, in addition to the first dose appointments that we have scheduled through the wait list, We are also conducting community outreach vaccination clinics to those who are high risk but do not have as much access. Reaching out to these communities is a cornerstone of public health in general and continues to be incredibly important during this pandemic. We are grateful to our community partners who provide valuable assistance in our effort to provide this much needed protection to those who might otherwise not be able to receive it. We continue to provide vaccines every day this week, including second dose appointments to those who've received their first dose through KCHD. Additionally, we are finishing our scheduled second dose appointments for those who are living in congregate settings and are developmentally or intellectually disabled. Once again, this is a high priority group identified by the state and one that public health is responsible for vaccinating. There are other opportunities to receive first dose vaccines this week through other providers across the community. We are beginning to see more organizations such as pharmacies and medical providers that are coming on board to provide vaccine, and that's exciting. So be on the lookout for these appointments. If you're able to take advantage of these appointments, please do so. The state has rolled out a vaccine finder webpage that lets you find vaccination opportunities based on your location. We encourage you to look at this website to see what your opportunities are. For an updated look at vaccine numbers across the county, you can check our vaccine information page. We'll be updating the data every Tuesday and Friday. On this page, you can see that more than 70,500 vaccinations have been given in Knox County. Here at KCHD, we've administered nearly 15,700 vaccinations. On this page, you can see how they are broken up into first and second doses, as well as viewing the demographic breakdown of vaccines administered across the county. According to the governor, the state hit a big milestone today with more than 1 million doses of COVID vaccine administered in Tennessee. We look forward to seeing that number continue to increase by vaccinating those in Knox County as quickly and efficiently as we can. Now moving to the local COVID-19 situation. We have 134 new confirmed cases since yesterday's report, 2,032 active cases, 60 Knox County residents are currently hospitalized. And sadly, we have 2 additional deaths to report today, raising our total to 517. And now I'll open it up for questions.
All right, the first question we have is from Brian Hornback. When the Knoxville Police Department and Pew CPA investigations are completed and turned over to the district attorney, will the media have the details for the citizens to know what happened to the 975 lost vaccines?
So those are great questions for KPD and Pew, as they'll be the ones making those decisions.
Also from Brian Hornback, many Knox County public education employees are going to counties more than 2 hours away to get vaccinated because KCHD does not have vaccines and 975 have mysteriously disappeared. What is your reaction to the lost production while these employees are gone to be vaccinated?
So first of all, we have vaccine. We are actively vaccinating people as I speak to you. We vaccinated over 300 people yesterday. We vaccinated over 1,000 people over the weekend. We continue to provide vaccine to our community and will continue to do so. Yes, unfortunately, there were 975 lost opportunities, but has not impacted our vaccine program and our plans. All this week, we'll be vaccinating every day, a combination of second doses and first doses. We are still working on vaccinating those in the high priority groups of 1A, 1B. We have not, our 1A1 and 1A2, I'm sorry. We haven't moved to the group that contains teachers, 1B, just like many other counties in the state, because we're focusing on the plan that the state has written and following it. We have moved to the 70 and older because we wanted to reduce confusion. To be honest, we hadn't made it adequately through the 75 and older. We're a big county with a lot of people. In that group, age group of 75 and older, there are over 30,000 people in Knox County that fit that category. So getting those folks vaccinated takes time. We are going to work in concert with the state as we can, but make no mistake, we have vaccine. We're actively vaccinating and we'll continue to do so.
From David with WVLT, is there a realistic date for when Knox County may be able to vaccinate teachers? And what is the health department's reaction to more Knox County teachers traveling to other counties to get vaccinated?
I think people have to do what they need to do personally to get vaccinated, and they make those choices personally. The challenge is that then they'll need to travel back to that county to get their second dose, because doses are being allotted to the counties by first and second doses and kind of matched dose for dose. According to the Tennessee Department of Health, we'll probably be moving to the teachers group in early March. We are actively working with other community partners to help us get teachers vaccinated. When we look at Knox County schools, their group, their teachers plus other employees that fall into that category, it's a lot of people. It's thousands of people. We add private schools and daycares, childcare into that. So we're actively planning now to make that smooth and seamless. But I would say the same thing that I've said to everybody, to teachers: if you get an opportunity to get vaccinated, go and get vaccinated. Teachers are important and we want them all to get vaccinated, but we are also focusing our efforts on those other groups right now, as we have not made as much of a headway into those groups as we'd like before we move to the next phase. But again, that being said, if the Tennessee Department of Health makes the decision, or the state makes the decision to move to other phases, we'll follow suit. Just because it's too confusing. We know people are crossing county lines, and that we understand that. So we don't want somebody who lives in another county to come to Knox County to get vaccinated and be told they can't get vaccinated, but they could in their own home county. So we don't want that to happen.
From Brian Hornback, KCHD is asking for a yearly rent of $68,400 for an old food city. Knox County has Summer Place Garage in downtown that could be used for a drive-through. The TVA East Tower for an indoor facility. June, July, and August, the high schools could be used. Why are you proposing a 12-month lease at a food city? Who owns the property?
Well, first of all, it's just a 6-month lease. So that's one detail. So, we fully vetted several locations, and what we needed was a place that we could occupy and use for an extended period of time and not have to worry about their schedule of other events, games, events, other things. Someplace that has ample parking, that's level for people to go in, has good flow. So, when you run a vaccine clinic, you need flow. You don't want people going back and forth, and you don't want people coming in and going out at the same place. So you want people coming in, going through the clinic, and going out a different door. We can do that at Food City. None of the other places were as available, reliably available, had the space, had the layout, and easily accessible by anyone in the county that we could use. We fully vetted lots of different options. We worked with the county procurement. We feel good about this location. We think it's going to set us up to be able to be reliably vaccinating our community on an ongoing basis.
From Cole with WBIR, what is your response to the hiring of an external auditing firm to examine what happened to the missing doses?
I have no problem with it. We have nothing to hide. We're not concerned about the findings. So I welcome scrutiny. I welcome people asking us questions. And, hopefully they'll see some things and we'll learn some things that we wouldn't learn on our own.
Also from Cole with WBIR, as of today, KCHD reports more people have received the COVID-19 vaccine than have tested positive for the virus. Can you speak to the significance of this milestone?
I think that's great. I'm really excited to be able to be here. But as I always, it's our job to remind you that we're not through with this yet. So keep on getting vaccinated. When you can get vaccinated, get vaccinated. When you're in your phase, get a vaccine, get fully vaccinated. That's your best protection. But even after that, you still have to wear a mask and social distance and be careful. It is not the time for us to let down our guard. None of us. Even those who've been fully vaccinated need to continue to wear a mask, social distance, limit your social interactions. That's the only way we're going to keep going in the direction we're going now. If we all go, woo, everything's over, we're good, and go back to business as usual, our numbers will shoot right back up. I guarantee it. We don't want to see that happen.
From Allie with KnoxNews, can you talk a bit about why Knox County's needs are different from smaller, more rural counties across the state when it comes to vaccinations, and how much would it help KCHD if more pharmacies could be activated?
So great question. For starters, we're a whole lot bigger than other counties across the state. We're the third largest county in the state. And we also are a regional, when we think about the phases that we're in, we are a regional medical referral center. That means people from all surrounding counties come here for healthcare, not just for their hospitals, but for their doctors, their pharmacists, their physical therapists, you name it. They come here for those services. And so we have a larger portion of people who work in the medical field who qualify for that 1A1 and 1A2 group. We just have a bigger population, so we have more people over 70 and more people over 75 than smaller communities do. Geographically, we're not the biggest county in the state, but we're pretty spread out and diverse as far as what's accessible in different areas. I think it helps when we think about access to vaccine or medical care or anything else, it only helps to have it helps to have different options for access. Because there are people who will come to a clinic that we do. There are people who won't come to a clinic that we do, and I get that. They'd rather go to their local pharmacist that they know and get the vaccine, or to their doctor's office that they know and get the vaccine. And I totally get that. The more options people have for how and when to get vaccinated, more people will get vaccinated. Right now, we're really limited by the supply. Even if we activated every pharmacy in the county, we don't have enough to supply every pharmacy in the county, or every doctor's office in the county. We don't have enough to supply all of those. So we're activating as we can and giving vaccine out as we can based on the supply that we're getting from the state. And the state's, divvying out the supply based on population and so a few other things, socioeconomics as well. Some of that plays into that factor. And when it comes to that, fortunately, Knox County, we don't fall into those high risk categories of socioeconomic risk. And that's not a bad thing. It just does somewhat impact our vaccine supply.
Another question from Allie with Knox News. When would you feel comfortable about adding those in phase 1B to eligibility? Several surrounding smaller counties and metro counties across the state are already vaccinating teachers and childcare workers. So it seems like that could be any day now. When can this priority group expect to hear about their appointments?
Well, let's hope it'll be soon. I think I already answered that, but we'll just kind of review. When we look at what we're doing, we will continue to look at how well we're penetrating the already activated phases of 1A, 1A1 and 1A2. We will move to the 1B group, probably in step with the state, which we anticipate being sometime in early March, but it could be sooner. We're kind of waiting on the state, and we're also waiting to see as we move through that 1A1 and 1A2 group.
From Cole with WBIR, the state has told hospital partners to distribute vaccine, not just to their existing patients, but to members of the public too. Has KCHD given similar guidance, and do you know if hospitals are doing that?
Our hospital partners are doing a really great job of vaccinating anybody in our community. All of our hospital partners are actively providing vaccine opportunities for the 70 and older group, people in the 1A1 and 1A2 groups. We talk with them. I talk with them 3 times a week about vaccinations, actually. And we're planning together on how we can collaborate and work together to make sure we get folks vaccinated. As we add people in the new phases, they'll be helping us vaccinate those folks as well. So I'm really happy with the partnership that we have, and built on the partnership that we previously had before the pandemic. And that's why these partnerships are so important for all of us to have. When we need them, we have those relationships and they step up and help us.
And Cole's follow-up to that question was, is anyone in charge of enforcing those guidelines?
Well, actually, what the state can do is they can pull, and they will do, is pull data from the Tennessee immunization website that tracks vaccinations, not just by hospitals, but by us, by anybody who's giving COVID vaccine, and they can pull and see if they're vaccinating outside those groups and have conversations with them. And you can get more information from the Tennessee Department of Health on that.
From Allie with Knox News, when a KCHD staffer signs for a shipment from a vaccine manufacturer, what are they acknowledging they received, the box, contents of the box?
As I said at the beginning of this, we're not going to be talking specifically about the situation.
From David with WVLT, he said it's not asked this in a long time, so where do you see us in the race? Are we seeing light at the end of the tunnel?
I think I can comfortably say that we passed the halfway mark, just barely though. And, it was a really long race to get here, and it's going to be a really long race to get on the other side of it. But that's where, just like in any race or any activity, it's not time to stop. It's not time to slow down. It's time to continue practicing the 5 core actions, even more now than before. We all know how to do them. They're easy. That you can do them and go about your daily life. Keep on doing that, or we're gonna go backwards.
From Cole with WBIR, what day of the week do KCHD and its partners typically learn how much vaccine they will receive? Do those shipments typically arrive on a particular day?
So that varies. It's communication from the state, and it's communication back and forth between us and the partners and the state, and then the state allots the vaccine and then ships it out, or orders the vaccine and it gets shipped from the manufacturer depending on which one they're using. So that varies. It's kind of ongoing communication between us and the state and our partners.
Also from Cole with WBIR, will substitute teachers be eligible when educators become eligible, and will any type of proof be required?
So their employer ID will be required, just like we're requiring for folks in the medical field. They have to bring their employee ID with them when they get vaccinated. That's a great question that we haven't thought to ask. We've asked a lot of questions, but we haven't asked that one. My guess is that, we'll write that down. My guess is substitute teachers who are actively engaged in filling positions would be eligible, but again, we need to double check that with our state partners.
Any further questions? Oh, another one from Cole with WBIR. What are some of the potentially underserved communities which KCHD is reaching out for vaccinations this week, and how is KCHD doing so?
So the African American community, the immigrant community, the Latino community, the English as a second language community. So how we're doing that is we're working with the folks who already serve and work in those communities to help us get access and help us actually message properly to encourage and increase vaccine uptake. We're working with, and again, with other groups, with African American groups to do the same, and partnering with them to help get those clinics scheduled. And then there's some other groups, some folks with disabilities that are high risk for complications that may have trouble getting somewhere. And so we're working with, again, the groups that serve them and work with them as trusted partners to help increase vaccine uptake and help us understand the best way to get them vaccinated.
And Cole's also asking if you could speak to why it's so important to reach out to underserved communities.
Sure, great. That's a great question. And what we know about vaccine and underserved communities is that typically we see low uptake, especially among the African American population. We actually have lots of data for this when we look back at our FLUMIS clinics. We see that our African American community, in those schools, we have lower uptake than we do in our schools that are primarily white schools. So we see lower uptake, and so it's very important. In addition to that, with COVID-19, all of those folks are at higher risk for complications, hospitalization, and death from COVID than their counterparts. So it's very important that we get those folks vaccinated and protected against COVID.
From Alan with Inside of Knoxville, why did the KCHD decide to go with Moderna vaccine going forward? Isn't Pfizer the most effective?
They both have very good efficacy. It's over 90%. That's amazing efficacy for a vaccine. We decided to go with Moderna because Moderna is a little bit easier to store. You don't have to have a special super cold freezer. And we've been using a super cold freezer from a partner. It gets shipped in smaller amounts, so it's a little bit easier to take out to a small event where you're only maybe going to vaccinate 200 or 300 people and not 1,000. So for all those reasons, when I was talking to the state about vaccine availability and they wanted to know which we would prefer, when I talked to my staff who handle the vaccine and do the clinics, Moderna was the one they preferred, and we'll be getting that going forward.
Any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time, and we will see you again on Thursday. Have a good rest of your day.